We grew very rapidly over a course of a very short time and realised that we didn't really have any strategic direction or focus in the area of health and wellbeing. It was determined that it needed to be a strategic priority. Our staff were asking for it, and because of our resources and being challenged by lack of resources, we were excited to partner with the City of Whittlesea. We are now undertaking a safety and wellbeing survey on health and wellbeing activities and behaviours within the organisation, in which we will get a sense of where people sit in terms of their own behaviours and what they'd like our focus areas to be through that survey. It's aimed at all levels of the organisation, and it's had endorsement from the executive and filtered down through the staff body who have created an authorising environment so that they feel comfortable and happy to actually participate in the process. As part of our normal planning processes as an agency, a health and wellbeing charter was developed and developed through feedback from staff and then taken to management for their endorsement and commitment and a final sign-off, also endorsed by the board. So our approach was fully authorised by all levels of management to engage the rest of the staff in the implementation activity. The factors that supported our progress through the program was the fantastic support by the staff at City of Whittlesea through the Healthy Together Achievement Program. We had fantastic support, advice, resources offered, and the information that we needed to help us progress was easily available, which was definitely appreciated. Some of the barriers for us in progressing through the program have been the amount of change that we've experienced over the last 2 years. We've had a number of restructures organisationally, we've had a merger, an accreditation process and staff turnover of key roles charged with driving and implementing the program within the organisation. So that's been a real challenge for us in just maintaining some momentum. Also, we have a geographically diverse workforce across 7 sites, most of which are doing outreach work. As a result, they're not as available as we would like them to be to participate in information collecting and also activities that we implement, so that's been a challenge for us. So some of the changes that I've observed are on 2 levels. There's been individual changes within the organisation for particular behaviours, certainly amongst leaders who've endorsed the program and are leading by example in terms of their health and wellbeing behaviours, which is fantastic for the team. The Achievement Program is a way for us to support and progress those processes. It's been driven by the information that we've been collecting over time. Also, it will assist us in providing those focus areas and some activity ideas to make sure we're pushing through what people actually want to do and progress through the program. In terms of doing something differently, we would look at making sure there was knowledge management processes or better knowledge management processes, so when key people left, the information didn't go with them, and that way we could keep the momentum going for the program. If I was to give advice to anyone looking at joining the program, I would say absolutely do it. The program is fantastic support to organisations in terms of consultancy and advice and support in terms of resources as well. Fantastic resource in the grant that was offered to us that has enabled us to actually progress through the program. So in terms of ensuring the sustainability of the program, we will be setting measures through our Safety and Wellbeing Committee. We'll be developing a safety and wellbeing strategy related to the areas identified through the Healthy Together Achievement Program, and they will have timelines and measures that we are accountable to.